everyone. My name is Dr. Ali. Welcome back. For those of you who are joining us for the first time, please subscribe to continue to be part of this healing community where we share knowledge and research that we need to heal and sustain good health. I'm a functional physician, and my goal is to provide education and guidance to our patients and their families, as well as our community, on how to achieve optimal health and wellness. Everyone has the ability to achieve optimal health by making simple, sustainable changes to our lifestyle. We can prevent and even reverse chronic disease. So, let's talk about the topic we have today. The topic we will be discussing today is 7 ways we can reduce the risk of stroke. Now, May is a National Stroke Awareness Month, and hence we have chosen this topic, which is a very important topic. We will talk about the symptoms of stroke, the risk factors, and how we can actually reduce our risk for stroke. So let's start off with talking about what a stroke. So a stroke occurs when the blood supply to a part of the brain is disrupted. It's either due to a blockage of a blood vessel or there is a bleeding in the blood vessels. In both the cases, there is interruption in blood flow, and that leads to damage to the brain cells and ultimately death. That leads to part of brain that stops working or functioning, which means that we lose function of parts of our body. So, when somebody gets a stroke, how do they know that they're actually having a stroke? The symptoms of stroke could be sudden weakness or numbness in one part of the body. For example, somebody could have their arm or their leg feel numb or weak, and they're unable to move that arm or leg. They may feel like they have one side of the face which appears to be numb. They may have difficulty lifting their feet or lifting or holding objects with their hands. They may also find that there is a drooping of their mouth, which also indicates that there is the possibility of a side of the mouth that is not functioning. They may also find that they have trouble speaking, or they may have trouble understanding speech. They may also find that they have slurring of speech. They may have difficulty finding the right words to express what they want to say. They may also have difficulty understanding what others are saying. Another area where we see symptoms is visual problems. So if there is a sudden blurriness of vision or sudden reduction in vision in one or both eyes, double vision or seeing dark spots or shadows can also be part of the symptom of a stroke. In strokes which are related to bleeding, there is often a severe headache. Another very important symptom of stroke is a sudden and intense headache without any known cause, and the patient may describe that as the worst headache that they have actually experienced. Another area is dizziness or loss of balance. Patients may have difficulty coordinating their activities. They may have difficulty walking. They may have difficulty doing the regular day to day activities. They may feel that they're dizzy, or they may experience a sudden unexplained fall. All of these are symptoms that there is a possibility of stroke, and the patient needs to immediately get to the ER via ambulance. Now, as we have talked about before, that there are two types of stroke. The ischemic stroke is a stroke which occurs when there is actually a blood clot which blocks the blood vessel in the brain, and the blood supply is cut off, leading to the death of part of a brain. Ischemic strokes are the most common type of strokes, and about 87% of all strokes are ischemic in nature, and they occur when a blood clot causes obstruction of the blood vessel. The second type of stroke is hemorrhagic strokes. Hemorrhagic strokes are much less common, and they account for about 13% of all stroke cases. In this, there is actually rupture of the blood vessel, and there is leakage leading to bleeding in the brain. Causes of hemorrhagic strokes can be, very importantly, high blood pressure. The second cause could be aneurysms, which are bulging of the blood vessels or thinning of the walls of the blood vessels, and that causes a rupture of that aneurysm leading to stroke. And then, of course, a very important cause is that if a patient is on blood thinning medications and they have trauma, and then that leads to some kind of bleeding, and then they get into what is called a hemorrhagic stroke. So now, what are really the causes and the risk factors for stroke? So one of the very important risk factors for stroke, including both hemorrhagic stroke and ischemic stroke, is high blood pressure. When blood pressure is consistently elevated, it puts strain on the blood vessels, which increases the risk of that vessel to get damaged. And there could be a clot or there could be bleeding. Another very important risk factor for stroke is diabetes, and we know that people with diabetes are at a much higher risk of heart disease and stroke because high blood sugar damages the blood vessels over time and hence puts these patients at very high risk. Another important risk factor is excessive consumption of alcohol. We know that heavy and prolonged alcohol can raise blood pressure levels, and it also increases the likelihood of developing conditions that contribute to stroke risk, such as atrial fibrillation. Atrial fibrillation is an abnormal rhythm of the heart, and we know that alcohol directly damages the heart, which also means that in these individuals, they have a much weaker heart to start off with. Atrial fibrillation, as we have talked about previously, is an irregular heartbeat. It's a condition which leads to formation of blood clots in the heart, and that if this clot travels to the brain, it can block a blood vessel leading to a stroke. Another very important risk factor is high bad cholesterol. And the reason is because high bad cholesterol causes or could indicate the possibility of a blockage of the blood vessel and increases the risk of both stroke as well as a heart attack. Now, it is important to remember that it is not enough to just look at bad cholesterol per se, which means the LDL. LDL is a number which indicates a potential risk factor. It is also very important to look at other markers of inflammation, to look at the complete picture. It is also important to look at what type of LDL the patient has because there are bigger particles and there are smaller particles. And if you have smaller particles, a smaller particle size of LDL, or you have sticky LDL, then you have a much higher risk than somebody who has bigger particles of LDL. So simply looking at the number of LDL or the amount of LDL is not adequate. Drug abuse is another risk factor. So people who use illicit drugs such as cocaine and amphetamines are significantly higher risk of stroke because these drugs cause constriction of the blood vessel, which leads to irregular heart rhythms. Another risk factor is smoking because smoking directly damages the blood vessels and increases the risk of not just stroke but also heart disease. Obesity and physical inactivity are both risk factors for stroke. We also know that people who actually have what we call visceral obesity, which means they have belly fat, are the individuals who also have very high degree of inflammation. These individuals are also at high risk for developing high blood pressure, diabetes, and high cholesterol, all of which are risk factors for developing stroke. We also know that genetics can predispose an individual to an increased risk of stroke. However, just because you have a family history of stroke does not necessarily mean that you will have stroke. It simply means that you are predisposed to it. And what kind of life that you live, what kind of lifestyle do you have, and whether you activate those genes that you have or not will ultimately determine if you will have issues with heart disease or stroke or not. And so, simply because you have a family history does not mean that you cannot prevent stroke. So, prevention solutions for stroke. So, we're going to talk about 7 solutions. The first and foremost is maintaining a healthy blood pressure. So, we know that blood pressure plays a very important role in not only stroke, but it also plays a very important role in heart disease. It also plays a very important role in the health of the heart itself, And we know that when somebody has, high blood pressure, there is an issue with regards to weakening and narrowing of the blood vessels over time. And so it is very important that if you have a history of high blood pressure, you have to keep a blood pressure diary, you have to monitor your blood pressure. You want to make sure that your blood pressure is actually in the normal range. Numerous studies have shown that even a modest reduction in blood pressure can lead to a substantial reduction in the likelihood of stroke. So it is very important that we pay attention to our blood pressure. The second very important area where we can work on is basically Mediterranean diet. This diet is associated with a lower risk of stroke as well as lower risk of heart disease. So there are many advantages of a Mediterranean diet, including lower blood pressure. It also reduces bad cholesterol. One of the reasons it does that is by healthy fats like olive oil and avocados, which lower bad cholesterol and increase good cholesterol. Mediterranean diet is also a diet which lowers the blood sugar level, uh, because it has a lot of fiber, it has a lot of whole grains to it. It's also a diet which is associated with weight control. We also know that it's a diet which is known as one of the types of diets which reduces inflammation. So it is definitely helpful, and it also reduces blood clotting because it actually has what we call certain components which actually have omega-3 fatty acids found in fish, which is part of this diet, which is known to reduce blood clotting. It reduces the thickness of the blood, which actually helps with stroke. So there are many reasons why a Mediterranean diet is a very good diet for people who actually have issues with or are predisposed to heart disease and stroke. This is one of the key things that we can do on a regular basis, which is 150 minutes of moderate intensity exercise every week. And this is not only going to be preventing stroke, but this is also a prevention strategy for reducing blood pressure because we know that physical activity strengthens the heart and improves its ability to pump blood efficiently, which leads to a reduction in the strain on the blood vessels and lowering of the blood pressure. And you can opt for any kind of aerobic exercise, whether you go with brisk walking, jogging, cycling, and you want to do that for at least 150 minutes per week. Um, Moving on, another very important factor to reduce the risk of stroke is quitting smoking. Quitting smoking is an essential step, and we know that tobacco is a significant risk factor for stroke because it directly damages the blood vessels. We've talked about this before. This is a very, very, very important variable here, which is reduction of inflammation. So we have to understand if somebody has high LDL or bad cholesterol or they have high blood sugar, what that indicates is that they definitely have high inflammation. And so when inflammation goes down, blood sugar actually improves. When blood sugar improves, inflammation goes down. And when inflammation goes down, then your LDL, which is your bad cholesterol, also goes down. So the question is, how do we reduce the inflammation? And so one of the ways we've already talked about is by using what is called a Mediterranean diet, which is an anti-inflammatory diet. That's one of the interventions that can be done. Of course, physical activity is another intervention which reduces inflammation. In addition to that, there's certain nutrients which are very helpful to reduce inflammation, one of the most important being omega-3 fatty acids, which come from fatty fish. They are also in walnuts, flax seeds, and chia seeds. They have anti-inflammatory properties, and that can be extremely helpful in these individuals. The other way you can reduce inflammation is by stress management, because a lot of times people who are under a lot of stress, who have issues or who've had a history of trauma, who've had a lot of micro traumas, not just macro traumas, actually have very high cortisol and they have very high inflammation. And so managing stress, and overcoming the stress of trauma, if you have faced trauma in your life, whether you do that through mindfulness techniques such as meditation or yoga, or you can also use what we call um, microcurrent neurofeedback as a means to overcome your trauma. And another very important variable, especially for reduction of inflammation, is quality sleep. So at least 7 to 9 hours of quality sleep a night is critically important, for reducing inflammation. And last but not least, as we have talked before, that a healthy weight is very important, because when you have fat in your belly, that indicates inflammation. And so it is very important to make sure that your visceral fat or fat in your belly is minimized to reduce inflammation. We've talked about alcohol consumption being an issue because of its potential targeting of the heart. We've talked about that because it can lead to atrial fibrillation. Also, it can also cause high blood pressure. So definitely alcohol consumption needs to be reduced. And this is a very, very important variable which most people don't really think about, and that is leaky gut. So, what we now know from the data that we have is that studies have shown that the gut bacteria, which we also call microbiome, which is a collection of microorganisms that are residing in our gut, plays a very important role in stroke risk and recovery. We know that imbalances in the gut microbiome can occur in what we call leaky gut. So, one of the causes of leaky gut is imbalanced microbiome. And that uh, then leads to systemic inflammation. And we know that inflammation is one of the key factors that leads to stroke. And in more than 90% of people, the source of inflammation is the leaky gut. And the reason why there is the leak is because of this abnormal gut bacteria. And so we know that if we can identify leaky gut and we can identify the causes of leaky gut and we can address that, that would automatically affect all the conditions that are a result of inflammation, such as high blood pressure, high cholesterol, and the immune function. And it will definitely affect and reduce the stroke risk. So, leaky gut is a very important variable. We also know that people who have leaky gut have issues with nutrient absorption. And that is important to understand because nutritional deficiencies can lead to chronic health conditions. Uh, and so the other very important variable here is that the immune system plays a very important role in preventing chronic disease and promoting overall health. And we know that the immune system, because it resides in the gut, the majority of it, and if you have leaky gut, then we directly have an issue with the immune system. So there are many reasons why it is very important to reduce leaky gut, because it gives us way more advantages than simply just reducing our risk for stroke. But if you have predisposition to stroke, then it's critically important that we reduce the leaky gut. We identify it, we assess it, and we reduce the leaky gut if it is present. Thank you so much for joining us, and we hope to come up with more new information on a weekly basis.